Good afternoon, everybody. Welcome to this panel. So this panel is called Advances in Measuring Food Environments. It's part of this event that is making all of us proud because we see how much we advance in terms of concepts and policies. And now we're going to talk about measurement. I have here with me Professor Larissa Loures, who is a professor at the Federal University of Minas Gerais. She teaches nutrition, and she's also the leader of the study group of research and practices in food, environment, and health. Professor Paula Horta, who is a professor and researcher at the Department of Nutrition of the Federal University of Minas Gerais. And also Camila Borges, who is also a nutritionist, researcher at NUPENS USP and NEPA Unicamp in the area of nutrition and public health and food environment. Each one of you has 25 minutes for your presentation, and we have 30 minutes allocated for debate. So now we're going to start with Professor Larissa Loures. Please, Larissa, you have the floor. Just a minute. I would like to thank Letícia for introducing me. I also thank my colleagues for recommending my name, even though I'm not part of I am part of the organization of the event. But it's good to talk about the advances in measuring food environments. And I have to talk about community food environment focusing on inequality. To organize a little bit my presentation, because my mind is a little bit disorganized, I try to uh, to make a list of the points I want to approach. The first point that I would like to approach is how the community food environment is embedded in the models of food environment. I think this is very important when we talk about measurement or metric, because the community environment has changed over the decade. A second point that I would like to address is the main concepts and metrics for the deserts and swamps in the food deserts and swamps in the world. The third point is about the concepts and metrics for food swamps and deserts in Brazil. I'm going to talk a little bit about this because even though it's a subject that is studied a lot abroad, but we have only started recently to talk about this. So I think it's an ongoing debate that's been built right now in our context. So the fourth point are my final comments or reflections. I think it's part of a collective debate. So these reflections that I'm going to present are the outcome of a collective work that we do when we talk about food environments. My starting point is that the term food environment comes from ecology studies. In 1991, the term emerged for the first time. And this term is used in epidemiological studies. And this concept of food environment is expanded and is now understood. I tried to bring the most recent concept, and it is the interface between the consumer and the food system with and it encompasses availability, ease of use, convenience, promotion, quality, and sustainability of foods and beverages in built, cultivated, and wild environments that are influenced by the social, cultural, political environment and by the ecosystems that are in which they are embedded. These and this can be applied. Actually, the most interesting aspect of this evolution in conceptual terms is that we currently can apply this to countries of low, medium, and low income. Because it used to be that we worked with models that were aimed at high income countries. So this is very important to mention. So in this food environment, there are economic, political, social, cultural, and physical aspects. And there is also a change in nomenclature. So this food environment has been called physical, built, community, retail. There were many names. I'm not going to show you all the models of food environments because this nomenclature issue changed over time. In the current model by Downs and collaborators, it brings the community food environment as part of the constructed or built food environment. And it encompasses both the formal and the informal aspects. I would like to emphasize the informal aspect because in countries with middle and low income, such as Brazil, we need to foster this debate so that we can think about metrics and so on and so forth. That's why I wanted to talk about this. But I can't leave out the I can't inequality because we have left this out for a while now. So there are two studies, two theses, one by Milene and another by Ana Clara Duran, that talk about the inequality in the food environment, the community food environment, and also Paula, who was advised by our colleague, and also emphasized the community food environment. What we see is that the larger number of small stores and food stores are geared towards formal and informal immediate consumption. And we find also stores with a small variety of healthy foods, lower quality and higher price. We always try, because we have an international seminar, we are in an international seminar, we try to show our food environment, because we do discuss globally this food environments for medium and low income countries. It is important to show what it means when we say food environment in Brazil. These works that have been, these studies in Brazil show that for neighborhoods with less economic vulnerability, there is a higher presence of supermarkets and food street markets, and a higher availability of healthy foods. It's very interesting to see that in the reality of Belo Horizonte, we see that there are many street markets are located in less vulnerable areas. So we need to talk about this issue because we want to establish this debate on public policies. So from all of this scenario in community, food, environment, and also thinking about we can talk food environment in general, in addition to the inequality, we have this metaphor of food deserts and swamps. And these metaphors, they establish a dialogue with the type and process of urbanization in countries and with inequalities. One of these inequalities is food inequality. And all of this has to do with income, race, color, and also in Brazil, we have been working with synthetic indicators of vulnerability. And we understand that this bigger context of inequalities. So just to talk about this metaphor of food deserts, I think this is very important for us to think about metrics, is that this term, food desert, has been used was used for the first time by a resident of a housing project in the west of Scotland at the beginning of the 1990s. So I tried to talk about how this theme was consolidated and built. So first, there is this first use in civil society, and then in policies of supply policies, and then we come to the first concept. So the food desert is a mechanism through which poverty and social inequalities could be associated to worse health conditions. So this had a lot of repercussion in the media. So they started to say that this bad physical access to food was due, the outcome was due to the fact that it was hard to make healthy choices. When I started to study food deserts, one thing that was interesting to me was the issue of supermarkets. So in the chapter that we produced about food deserts, we went deeper to understand that the large supermarkets, or in Portuguese, hipermercados, they came to be accountable for the food deserts because they refuse or they deny the benefit of choice and good price to residents of certain neighborhoods. So the expansion of these networks of supermarkets has to do with this issue of food deserts. So there is a very interesting podcast called Panela de Impressão. It would be, and it talks about the psychology of supermarkets, but we don't have time to talk about this now. So as we produce that timeline for food environments in our study, and especially in Olivia's study, she is a PhD student. We have tried to understand the concepts and to build the timeline about this metric and conceptual development of food environments so that we can show that this concept of food deserts is built in parallel with food environments over time. So we have a study, the first study on food deserts, that happens in parallel with food environments. So over time, this concept is shaped. It starts with costs, and then it goes through having or not having stores, then physical access to food. And then there is this whole evolution. The most recent concepts talk about consumer behavior but also with metrics on stores. So I think these are very important points. So food deserts in general, they can be understood at neighborhoods that are vulnerable socioeconomically, in which the availability is low. So how to evaluate this or how to assess this? Most of our metrics are foreign. There is the USDA metrics, as you can see. It is a methodology used for developed countries, and we also have the CDC methodology or metric that proposes this index for food retail index. It's called the modified food retail index, and it classifies the health of how healthy the foods are. So we also have an evolution of metrics. These are not the same studies. Some studies work more with the conceptual and other studies with more with the metric aspect. And in the metric aspects, there are other variables. So we have the stores, but we also have income, transportation, quality of food, the number of workers and employees in stores that sell foods or food. So when it comes to metric, there is also the perception, if the person understands or not, that they live in a food desert. I think these are all very important variables when we think about measuring. The most recent concept from 2017 and 2018 include income and physical access to foods, and also the issue of transportation. When we think about vulnerable regions or neighborhoods, this is a very important variable. When we think about urban health, I think it's interesting that we have Letícia here on this panel. This is very relevant when we think about the metrics of food deserts for large urban centers. When it comes to food swamps, this metaphor is more recent. In 2009, a study conducted in New Orleans in Louisiana, in the United States, it points in the direction of the first concept. It would be neighborhoods, low-income neighborhoods with a large availability of stores that sell unhealthy foods that can flood the low availability of stores that sell healthy foods. So this is the I couldn't find the type of environment or the scenery that the Scottish person had in mind when they created the metaphor, but this are the swamps in Louisiana. So this shows what happened after the Katrina in the area of Louisiana and New Orleans, but it also shows that these are vulnerable regions or areas where food swamps happen.
So this concept of swamps is more recent, and we do have the proportion of non-healthy foods and the access to non-healthy foods. And in general, these food swamps can be understood as neighborhoods with a high concentration of stores that sell non-healthy foods and that have strong advertising and marketing. And in the US, usually this phenomenon takes place in low-income neighborhoods and where ethnic racial minorities are. And the most famous methods are those from developed countries. So the CDC is doing the same proposal, but with a different score in ranking these stores in a different way. We have used these convenience stores, corner stores, and small bakery shops or just small stores. And the result is higher or equal to 4 would be considered this food swamp. So I know that I only have 5 minutes, but in Brazil, we have several studies of associations regarding health and community environment, but I wanted to bring you some methodological studies. So, of course, I need to um, mention these colleagues that did this study in the urban area of Manaus, and that brought an interesting proposal that would include the environment of the consumer and integrating these to assess food deserts. So I really recommend that you read this paper. And he says that food deserts would be neighborhoods that have a lack of physical access to healthy foods. And these food deserts are more common in the poorer areas of towns. And I would just like to mention again that these alternative points of sale, informal trade will end up minimizing the low availability of healthy foods. And something important that these authors bring is up to which point can this traditional concept of food desert be applied directly to the context of transition economies? So I need to mention the proposal of Kaizen that stems from a collective effort, and I really respect what they're doing because they were able to work with the healthability of these stores. And you can see this proposal of food deserts, and we mentioned the density of healthy stores, which is healthy stores times 10,000 divided by the population. So to assess these deserts, what would be healthy stores? Stores where natural foods and mixed foods are sold. And the deserts are the neighborhoods in which the density of healthy establishments is under 25. And so I really like this infographic produced by IDEA that shows that in this mapping, 12 of 21 Brazilian cities had food deserts in peripheral areas to those cities. And this is a paper that was written by Olivia. And what did we realize? Well, we saw that we had to assess the absence of food stores in general and the absence of other stores that would sell predominantly natural foods, and other cities in which we see that there is this sale of processed foods. And so this is what we found, that access to food happens in a different way in different parts of the city. In the areas that have lower income will have less access to all types of environments. And even more than that, testing different methodologies from all of these, the methodology that was proposed by Kaizen was the only one that assessed these deserts in places where there was lowest income. And regarding these food swamps, when we identify the types using Hager's methodology, we were able to identify that food swamps were more frequent in sectors that had lower income. And so I also want to mention this association in Olivia's study in her second paper about social inequalities. And what we were able to prove using the data in her paper was that the areas of food deserts do have worse social populational conditions. The food swamps are more frequent in areas of of food deserts in the city, and that have low and average vulnerability. And there are areas in the city, 12.74%, that can be classified as food deserts and as food swamps. So we really need to take a look at these ecosystem that has food and desert swamp at the, food swamp and desert swamp at the same time. So this is our final reflection. So I'm also mentioning Camila's paper. She can talk about this because she's here. And as a final part of my presentation, I would like to mention some things and some aspects to a larger group. We realize that there are food deserts in places that have a lower quartile of food and of income, sorry. And we realize that a concept in which that can be seen in academia and also in people who are campaigning, and they're talking about food food apartheid or a food segregation. So the lack of healthy foods happens due to social inequality within the food system. And this discussion includes, but is not limited to, race, geography, faith, and economy. And we believe that these terms are not excluding, and this apartheid or food segregation includes social inequality in this discussion and includes these structural elements that end up creating these food deserts. And to close now, I would also like to say that the isolated assessment of deserts and food deserts and food swamps will only approach in part the reality of the situation of food in populations. So this quote from Kathleen Caspi states that we need to go beyond geographical access. We need to go beyond geographical access to food and also beyond the discussion of how to feed the needy. We need to focus on how food systems and food environments that are healthy and sustainable need to be reconsidered and redesigned to face the key causes of food insecurity and of inequalities in health. So I would love to talk more, but my time is up. So there are many recommendations here. So we have, podcasts and materials for you to read. We are launching this book, and also a very interesting podcast produced by Professor Paulo and his students. And I'm also available to take your questions in the end. Thank you. Thank you very much, Larissa. Larissa was able to bring a very important point to discussion. We had Beta on the table, and on that first panel, she had to connect the food system and the food environment and the consumer. And she talked a lot about how the food environment is this space that has capillarity that actually reaches people where they are. And so there was this heated discussion about a consumer or non-consumer, because we live in such an evil environment right now. And so to talk about consumers, people don't even have the money to have access to that. And so this connected to the desert segregation terms, I think was very important. Thank you very much for your presentation. Now we have Professor Camila, who will talk about metrics. And I know that there are questions about digital, and Paula will talk about this following. So we will talk about this area as well. So Camila, you have the floor. Thank you very much, Letícia. I want to thank you all for this invitation, for being here. Congratulations, Larissa, for this great presentation. And congratulations on organizing this seminar. We see fruitful discussions, crucial discussions for us to see the improvement of the food systems and of the food environment of Brazil as a whole. So this is my presentation. I'm sharing my screen now. So please interrupt me if I'm out of time, and let me start. So now I'm going to talk about the assessment of the environmental, the food environment of the consumer. And this is what I have been working with. The idea is to share some of our experiences of what we have done, our papers, and how Brazil has been working with the consumer environment. So first, we need to remember and discuss how the food environment in Latin America is. So we see diets that are poor in nutritious foods with a large amount of highly processed foods, not enough consumption of fruit, vegetables, and whole grain. And we have malnutrition in all its forms, obesity, non-communicable diseases, nutritional needs, and especially in Latin America, we see the lack of resources for prevention and control of chronic illness and malnutrition in general. And at the same time, we see that there is an increase in the food consumption outside the home. And in these countries in Latin America, we also see an increase from 2009 to 2019 in the sale of highly processed foods. And so it's very interesting for us to take note of that and see how the consumer environment is directly involved in this increase in sales and also with the consumption. So when we look at all of these factors and how they are related, we see that in the most current conceptual models and with all the choices that we have, and if we want to develop, healthier and more accessible environments, how can we look at this environment and how can we look to this system? And so I have this paper from Christine Blake, in which she talks about how these choices influence and in a way they can shape this food system, especially in low and middle income countries. And so in the scenario that we have right now, what do we eat among the available and accessible options in our environment? Why do we make the choices that we make? And how do we distribute, acquire, prepare, and consume these foods? And so I'm asking these questions because they are helpful for us to consider how we can assess this food environment in all of its facets. So to answer these questions, we need to assess different types and dimensions of the food environment, their characteristics and their specificities in the social, economical, political, and cultural scenarios. And so here we start and talk about the consumer's environment, food environment. And we know that this is being discussed and mentioned now. This is one of the first models of food environment. So we are taking into consideration the ecological definition. It's the Glassky model. And this model, even though it's an older model, it is a way for us to consider the consumer's food environment. It's very educational, but we know that the typology of the environments have this focus on retail and informal retail stores. So according glance, the food environment of the consumer is related to prices, availability, quality, variety, nutritional information, the way products are positioned advertising, marketing that are available inside retail stores that are selling and distributing food to this population. And we know that this model has shaped how these instruments, these assessment instruments of the food environment of the consumers has been built. And in other countries, we see that this has been adjusted culturally and in different ways. And so this has been a model that has been widely used to build tools and also to find the indicators for this environment. And here, using this conceptual model as reference, we can include food retail within the food environment. So what is food retail? How do people access it most of the times? Still, remembering that in countries that have low and middle income, and we can discuss this towards the end, we know that there is this large informal network, this supply chain. But of course, food retail is very important to distribute food, especially to get food to people. So markets, supermarkets, they vary in the type, variety, availability of food, but also the way that they're accessed, the people who actually go in these stores is varied. So this was a discussion that the FAO did in 2017 in one of their publications, written by one of the great experts in food security, nutritional security. And he was talking about how retail has a very important role in the access and availability of food. And the environments of food retail, they shape the choices that people make, and they also shape the energy consumption that is done. So there is this whole set of strategies that influence the choices of these consumers. We know that in Brazil, 49% of food purchases are made within supermarkets, and this was the data from a survey that was done. And we know that purchasing things in supermarkets increases in 25% the purchase of foods and beverages that are highly processed than if you purchase in other stores. And so in Brazil specifically, and I believe that in Latin America in general, we do have this variety of types of stores. These are just some of them, as you can see in the National Registry of Economic Activity. And you see, for example, supermarket, larger supermarkets, grocery stores, bakeries. We have wholesaling foods, fish stores. We have meat houses. We have liquor stores. We have candy stores, different snack bars, tea houses. There are 51 types of stores that sell food, and we also have food stands on the street, food carts, etc. So we deal with all this variety and of different points of sale for consumers to have immediate consumption or for them to buy and then prepare that food at their homes.
And we've seen that almost 50% of Brazilians purchase food at supermarkets. So supermarkets, they play a very important role in supplying food for Brazilian households. At the same time, and Priscila Machado talks about this in her paper, there is a huge contribution of informal markets, the mercadinhos in Brazil, and also street markets for the acquisition of natural, minimally processed foods in Brazil. And as she says, purchase at supermarkets ends up making people buy more processed foods. And why? Why does this happen? What is it that makes consumers buy more food at supermarkets? So these are some factors that influence this behavior. And these are factors that influence the acquisition of foods in the environment of the consumer. The first is availability, then price, promotions, publicity and marketing, quality, and also the position of the product, the location. So the ones that are most used are these. So we know that the studies of food environment, the number of studies increases every year. This is up to 2014. There are much more studies nowadays, and at the same time, we see that it's a very complex subject. These environments are very dynamic, so we need to work with concepts, methods, and metrics to be able to study the specificities of these environments. And choosing the conceptual model is the starting point that will contribute to choose metrics and choose the concepts and to discuss the indicators to assess the barriers and the hindrances or the conduciveness of this environment to purchase food. So we need to think about robust measurement instruments, methodologies, and to measure these health outcomes. So I brought the result of this review that used in this article up to 2014 and showed that only 25.9% of the studies reported the reliability and 28.2% reported on the validity of the metrics and instruments used to assess the food environment. Few studies report validity of the construct in the development of new indicators to assess the food environment, and the instruments or the tools that are more common. The most common instruments used to assess food environment and consumption are questionnaires, are checklists that are applied at the place of purchase. And these are the most common contracts used in the food environment for consumers. So when we talk about checklists and questionnaires to study food environments of the consumer, we see information about food availability, price, quality of fresh foods, promotions, placement of products, publicity and marketing, room for on the shelves for certain types of foods, difference in displays, physical features of the place of the stores, broader or narrower aisles, marketing strategies that are many, accessibility and nutritional information, variety of foods, visibility of foods, and also the signaling of the shelves for healthy or not healthy foods. So this study found, and this review, the systematic review, was that most of the studies that assessed the food environment did not talk about conceptual and validity for each one of the constructs and the dimension, construct and dimension proposed by the tools. So this is very important for us to mention because in Brazil, we have advanced in this sense to having more solid constructs and testing the quality of these constructs. So I'm just going to go quickly on a review of the tools, metrics to assess this environment in the last few years. So in 2010, we had a very important study by Professor Paula Martins, which was an adaptation of NEMS to urban areas in Brazil. So this was the final the initial, was the kickoff for this assessment of our scenario. So we started in 2010 with this study, this validation of an adapted version of the nutrition environment measurement tool for stores. Then we have Patricia Jaime, who works at ESAL, and she developed two tools, one to assess restaurants and the other one to assess retail stores such as supermarkets and markets. And then in 2019, we also have another study coordinated by Professor Patricia Jaime as well, which is the development of an evaluation of an instrument to audit the food environment, which is called Audit Nova. And then there are a number of other instruments along with Audit Nova. And now in 2021, we have scores, indexes to assess the healthiness of these environments. This is a study by Letícia Tavares, which is a healthiness score to assess commercial establishments that sell foods for immediate consumption. We also have other studies, some still to be published, that show an assessment of this consumer environment in other scenarios, for example, inside universities. And I'm going to talk now about how we built this, how we construe this. So we build tools for our reality. So ESAL-S and ESAL-S and ESAL-R are used to evaluate the use of in-store measures in retail food stores and restaurants in Brazil. So we want to check. There are tools that bring about an index that is a synthesis to assess these establishments, these restaurants and retail food stores. So we see that when they are applied to different socio-economic realities, they are very useful. So when we see the different indicators of the tools, they are availability, variety, publicity, and they focus on some markers for healthy foods such as fruits and vegetables, and non-healthy such as sweet beverages and so forth. So we know that the food guide was published in 2014, and along with Professor Clarissa, we started to see if we could review these tools that had been produced by Ana Clara and Professor Patricia Jaime as well. So we created Audit Nova. So it is a tool, auditing tool for the food environment, consumer food environment. And we worked with trustability analysis. And we also include availability, variety, but then there is also positioning of foods, placement, price, publicity, and information, focusing on all four groups of foods in the new food classification. So we think about a broader list of foods than the one produced by ESAL. And we wanted to include foods that are representative of Brazilian food habits or eating habits. So we see in the analysis phase of Audit Nova, we validate the content through a very important process of developing a new tool, in addition to reliability, test and retest. and also to assess changes in the application of the tool over time. So we have kappa indicators, correlation coefficients between assessors or evaluators over time. We also have the choice of dimensions and indicators, especially when we think about publicity, information, and placement, because we know that marketing strategies, they change the way people consume. And this ends up affecting the quality of the metrics that we use, and we need to improve this. And also, we based the choice of dimension and indicators in literature reviews, thinking about what influences the consumer in this environment. And we found also that there was a need to have a score, a healthiness score. So we built this healthiness score, or consumer food environment healthiness score, and we worked with two dimensions, one of publicity in the environment and physical structure, and the other one had to do with availability and price. So why did we divide the score in two dimensions, environmental and food? Because we wanted to understand how publicity or placement strategies would make this retail less successful to foster the consumption of healthier foods. So in this analytical part of the score, we developed the validity of construct, because we wanted our score to reflect a theoretical concept that we had, considering other parameters used in Brazil to validate this environment. For example, Paulo Castro divides the stores in mixed environments, processed or ultra-processed food environment. And we wanted to check for the validity of the score. And we wanted it to be able to discriminate between the different types of stores. We showed that the score, our analysis showed that the score was able to find the differences of environment of different stores and foods offered. And this was the first study in Brazil to consider the level of processing of foods in a score. And also, I bring here that the score, in a way, can be used to test the association between a retail environment and the food behavior in multi-level studies about the determinants of obesity and chronic diseases. And here I also bring Letícia Tavares' study, which is very important because it's a huge advance in Brazil, because it's a score to assess immediate consumption commercial establishments. And in this study, we developed 4 indicators based on the availability of natural and minimally processed foods. And with these indicators, we can have a score from 0 to 100 that express the idea that a given commercial establishments promotes of health, eating, and makes it easier for consumers to access minimally processed foods, and makes it harder to access ultra-processed foods. And this is, we know that auditing processes are very rich in terms of information, but they're very costly and it takes a long time. So it is interesting because this tool offers a faster and cheaper analysis. So thinking about Latin America, Informa's module structure, I promise I'm almost done. It's been applied in many different countries, including Argentina, Chile, Brazil, Ecuador, Panama, Guatemala. But there are protocols such as retail protocols that can be used to compare and to monitor public policies. I also bring us for us to close at thinking about the informal supply scenario. It's very important for our reality. We saw in our studies in the municipality of Jundiaí a high concentration of ultra-processed food sales in drugstores, which is a place that we would say, well, this is atypical because why would they sell ultra-processed foods at drugstores? But we need to take this into consideration when we audit food consumption. And we need to think about the transition of food environments. As Shana Dons mentioned yesterday, this environment is in constant transformation. So we need to assess the tools, reassess the tools we used, and think if they are able to capture these more informal markets and also the distribution. So, for example, community gardens and community markets. So now to conclude, Brazil launched the production of indicators and tools to assess the food environment, the consumer food environment. But I think that Brazil advanced a lot. So we need to review the tools that we created. We need to include validity tests when we create new metrics, indicators, and index of the consumer food environment. We need to propose new indicators that are based on sustainability, which is the most current model, which Shauna Dons brought us yesterday. We need to establish surveillance systems to predict and follow up changes in the consumer food environment in the long term. We need to develop simplified measures to assess the environment that are valid for our context. Thank you very much. I went over time a little bit, so I apologize.
Thank you, Camila. I realized that there were two points in common between Larissa and Camila, which is our desire to connect concept and assessment. So if the concept changes, you need to change the assessment as well, the measurement as well. Because why didn't we talk about the indicator of density? Why? Because we know this, but what else, So we are moving forward. I really feel that we are moving forward. We are trying to be dynamic, even though we have some issues. There are some questions regarding the informal situation, and we're going to have a very fruitful discussion. So now we're going to give the floor to Professor Paula Horta, who will talk about the digital food environment. Thank you. Good afternoon, everyone. Can you hear me? Yes? Okay. So I would like to thank the organizers and the recommendation from my colleagues to invite me to be one of the speakers here to talk about the digital food environment, and to say that I'm very happy to be here with the other panelists. So this is the structure of my presentation, some initial concepts for us to discuss and talk about measurements in these environments. As we talk about the different instruments and tools that we have to make these measurements, we're going to talk about the challenges and the gaps so that we can continue to move forward. And then in the discussion, we will have enough time to really go in depth into other matters. So talking about information food environments, that is what we have in terms of information. And in general, this is food advertisement. So we have a concept that food advertisement is a marketing dimension that wants to lure consumers, and that is done by communication of products and services that will try to change or reinforce the consumer's behavior. So advertisement is informational, it is persuasive, and there is a commercial aspect because they want to sell and they want to have loyal customers. And when we talk about exposure to advertisement, and this is one of the issues that is part of the food environment, this is much related to how much this person is exposed to this advertising message. So the number of times that a given advertisement, a given ad will reach a person, and the number of people that are actually reached by a specific advertisement message. This is important to assess the exposure. And we also need to consider the quality of this message. And this is related to ad strategies, different resources that are used. And so these two dimensions, because they are related to impact, they need to be monitored. And what we're going to see is that many instruments in the informational environment use these two dimensions. So there is a very specific focus to children and how vulnerable they are. Literature is very clear to state that children are the most vulnerable to ads up to 12 years of age or up to 16 years of age. Some authors say that children cannot distinguish between ads and information. And so that's why we need to protect children. They cannot be exposed to this type of ad. So there is literature that that supports this. And so we're going to see that many different measuring instruments are should be encouraged so that we can protect children. But I would like to say that adults are also vulnerable because of all of these sophisticated marketing strategies. Many people don't even realize, and maybe they don't even have the cognition to do it. But the fact that technology has been widespread and makes us a lot more exposed to technology makes us understand that it's not only cognition. We need to make informed decisions. There are many other factors involved. We have emotions, affinities, things that make advertisement something very sexy for adults and not only for children. Okay, elderly, for example, anyone who's over 16 years of age. So regarding the spaces of this information environment, some of them would be the traditional media, magazines, TV, and the radio. It's very different from what we have now. We have digital TV now. We access online content, and the radio does not have this format anymore, right? We still listen to the radio in the car, but we have listened to a lot of music on our cell phone. So even traditional media has really changed in the last years. And we have another group of different spaces where ads are included. And one of the dimensions is advertisement. We also we have advertisement in schools. And so these two topics are two topics that I won't go into because we have already discussed. We have advertisement in the environment, bus stops, subway, billboards, and we do have digital exposure on our cell phones, in different apps and websites, and also social media. So this will be my focus. I'm going to talk about TV, even though we know that it's traditional media. It is still a very important mean where people are exposed to. And I'm also going to talk about digital media. I would like to talk now about some specificities that create the challenges that we have to monitor this environment. Of course, we are talking about a given space where advertisement has different faces. So we have organic advertisement, the one that this brand will do on their website or on their social media page, and they're not directing this to anyone, and they're not paying for it to be advertised. This is the most commonly monitored advertising, but it does represent a very small part of the advertisement that we see in these media. We do have paid advertising, and we also have influencers. Influencers are being hired by companies to advertise their products, and not only for food, but for all sorts of other products. And these influencers, the more followers they have, they will be considered, greater influencers. And we do have these ghost followers, fake pages, so that that person can appear to have more followers. We do have commercial partnerships that many times are not transparent about it. We have people that do advertisement, and this is not really clear. It's not stated that this is a commercial partnership. Maybe it's just a common person that is advertising that product because they want to. Now, we need to consider all of these aspects. We have viral content that will reach a huge number of people. And if it's an advertisement, you can imagine the reach that that will have. We have native advertisement, which is done for you not to see it. So it's there on that page, and you're just looking for something, and you see things on, on that company's colors, on that company's font, but you don't know that it's advertisement. And we also have displayed advertising, like a billboard. So we add all of this to the idea that advertisement is geared and driven by our data. And we do have efforts like the GDPR that has been used to protect our data, but this is still something very, very new. And we know that, this brand is at our hands. And so we are always using screens to access things. So it's different from watching TV and then watching an advertisement when you're watching TV or listening to advertisement on the radio. So now I'm going to talk about the digital environment. And I know that there was a panel about this topic. So I'm just going to mention some issues that were talked about, this digital food environment. You can watch the recording later if you want. And I would just like to remind you that the digital environment is the way that the person can come into contact with food in the digital world. So it is connected to the physical environment, and in the different dimensions that we have in this digital food environment, we have some contexts that we need to be interested in and pay attention to. So we can assess the context of different social media platforms, websites, and apps, or we can also assess and monitor different players, such as the food industry and the influencers. So we do have the potential to assess all of these. I'm just trying to highlight the most common ones, even though they're not, they're unknown to some people. Now, talking about the concept, this is a drawing that allows us to see the food environment in all of their dimensions. Let's try to think about this. So the information environment is included in this. We will have this environment within a store, within a person's home, within the spaces where they are. We have this digital environment there because the person is using their cell phone at any given time. There's digital TV and different spaces. And we do have a common area between these two environments, which is the advertisement, which is in the digital environment. So these are two environments that are part of this greater environment that we have. So let's talk about measurements and mentioning television, which is the most traditional and monitored media. So Camila talked about the Informas protocol, and we have considered many different things related to the environments that need to be monitored. And we know that this is not a recent report. You can use the Informas protocol, not only the food promotion one, but others that are listed here.
And if you want to collect information on TV, you can think about what months of the year are more strategic, that are connected to celebrations. How many days in a month should be selected when you think about days of the week and weekends. A number of hours. There is also the information regarding the channels that are directed to children, and how to classify open and closed channels, and also how we can analyze these foods. And there are two pieces of guidance. One is the nutritional profile from the Pan American Health Association and WHO as well, and also to how to assess the food groups. They have the NOVA classification using the Australian groups, but in Brazil, we work with the NOVA classification. It's a very detailed protocol that tells you how to collect data. I think it's a very challenging part of getting the recordings of the TV shows or the publicity, actually. And then it's a lot of labor. It's a lot of work to get artificial intelligence algorithms to get the content. I think that one of the bottlenecks is this large volume of recordings. We had like 18 hours a day for 8 days every month. So we have to watch all of this to get the content we need. And the other thing is the fact that some information is not that subjective. Are there cartoons? How are we going to talk about benefits or allegation of benefits? We're talking about suggested use. Are we talking about some emotional allegation? And normally this is more geared towards measurement. And then we assess the quality of this information. And this has worked well, but this requires training, and we need to be well trained to measure these dimensions. So I'm going to go into social medias now, which is, I think, what people have studied now. In this 2014 protocol, we have more literature about other types of media, but social media is more recent. We are finalizing this article. What I'm going to bring you is our evidences of an article we're writing. It's a scope review as a scoping review on food advertising on social media. So we took all publications of all posts of social media up to May 2021. So we used everything that was available up to May 2021. Our search strategies were social media concerning foods and marketing. We did double data extraction, analysis of quality of publication. So we didn't take exposure impact or anything like that. And we selected 25 studies. So I'm going to tell you, these are unpublished data. What we found was, and it's important to contextualize this because we had the idea of doing this because we study this, but it was very difficult because we had to determine what were the variables, and we were very insecure because we didn't have a tool that was devised for this. So we wanted to sweep the literature so that we could understand this better. So there are two dimensions. There are two dimensions of a data collection, and we can choose. We can do a branded publicity analysis. So, or we can choose to analyze the user of social media. We're going to look into the page of an influencer, for example. So we have two different paths. And we can also choose organic publicity and paid publicity. When we look into paid publicity, this is our major bottleneck because since it's directed to a given consumption profile, it is linked to the device, to the browser, or to what the person uses in the digital media. So now we have we have a way that we could reach this paid publicity, but it's very difficult, it's very complex. So most of the studies are conducted on organic publicity. So one of the processes that we need to do is to define what pages will be studied. So we need to define pages that have the highest number of users, or what are the pages that have the highest number of followers. So we think about food brands. If you want to study a company, you get this brand. But you can choose also a person who does publicity for our brands, or other studies. They work with the participation in the market or market share, or the companies that invest the most in publicity. There are some case studies that monitor, for example, one company specifically due to a given reason. Maybe it's a most popular company that is directed to a specific audience, such as children. There are some criteria. This is a first definition because after you define the social media, you have to think what the company is, what company you're going to study, and why. There are qualitative methods which deal with content analysis based on reading all the publicity materials, and normally you have a smaller sample to do that with a double analysis, and you define the themes. And then there is quantitative, such as a data collection protocol. On social media, what we have in content analysis or in quantitative analysis, more structured analysis, depending on the method you're going to use, you see more metrics than the others. But we were able to analyze some groups. So brand elements. So we collect logo, slogan, color palette, and information about the brand. There is another set of contents which are the features of the post. So you have audio-visual resources, the nature, if it's it's organic or paid publicity, the origin, the tone, which if it's positive, negative, neutral, the content, is it more informative, or does it talk about painting? What's the theme? Are there foods and are there people? And what are the foods and what are the people? What's the age group? Other very typical strategies in the digital environment pertain to connectivity and engagement. So elements of media, games, apps, if people are encouraged to talk, to comment. And then there is the singularities of exposure to publicity, because you can talk to the brand. This is something you can't do on TV. And we also have prize offer groups, as I showed for TV, promotion characteristics such as non-sport celebrities, athletes, or sports people, elements in the children environment. We have literature about this. Some did content analysis, and others were directed by other important documents and recent documents. So we have this document that showed some commodities industry behavior, unhealthy commodity industries, and COVID-19. So this is very interesting as well. This is what we've seen in social media so far. We also have a group of instruments to measure digital environments that is directly directed to children. It is a WHO Europe document, and I'm showing you a paper that does a brief review about a protocol to monitor food on the internet, and then they present the CLICK, which is a protocol to collect data on the exposure of children to food marketing in Europe. Each letter is a phase or a step, and it's a very interesting document or tool because it directs, even though it doesn't provide all information, and it doesn't offer all information because we don't know, we don't have all the information. It's a very new subject, but basically the first phase, the letter C, is to comprehend the digital system and to characterize the environment. What are the companies that are present in this environment? What are the most browsed or accessed digital environments? Also information about the publicity industry, the media. So it's a description of the ecosystems. And then we have a second step, which is a sweeping of marketing campaigns to companies and to identify what are the appeals, the strategies, the means of communication where the industry promotes their materials. We have the investigation of exposure and screen capture in real time. One of the things that we do is to have a device or a function in a digital device where you can see everything that is shown as a pop-up that is directed to the child, and also the use of software to capture the screen or record the screen of a given child. So of course, real-time screen capture is much more challenging. There's a large volume of recording, but there are very important ethical issues that need to be discussed on how to do this collection, data collection. And then the last one is how to do this to generate impact for society and in the academia. I recommend that you read this protocol. There are templates and the protocols to monitor on the internet. They have protocols to do data collection on the YouTube and also for influencers. We also have the studies where we monitor regulation of information, whether or not the publicity is compliant with the regulation. So there are methodologies for this. I know that Letícia, I know I've reached my time. I'm going to ask you for 5 more minutes so that I can conclude. I'm going to talk about the apps, the food delivery apps. I think that's a huge recent boom. When we think about the digital environment, we had something on digital media, but now there are some delivery studies in the world. And there are some initial information. We have no systematic review or protocols or scope reviews. We have scoping reviews. I'm only going to tell you what I know about what I've read and what we've been doing in our study group, our research group. First, you need to define what app you need, and this has to do with coverage and scope. If you want to study a city, what apps are the most popular one, or if you want to study in a country or many countries, I need to choose apps that are relevant for this scope, for this region. There is a definition of days and times. So lunch, dinner, days of the week, so weekend. So you need to have a variety of days, even if you don't see a difference and the features of this digital environment of apps, and there are the criteria to define what stores or what of what commercial entities you're going to use, are the ones that are closer to a given address. But you need to define what will be the criteria. So the popularity criteria is the most used. When you define what apps and the days and the times you're going to use, you may want to describe these stores. So there are literature studies that say that you should use the definition or the description the store offers, how it presents itself to the consumer. And you may want to create a classification for the stores. As we talked with Camila, as Camila said, you can also analyze the menus, and you can check for the food offers, the prices, the discounts. There are some criteria to assess that. I have some literature here on this, but basically there are indexes that have to do with the presence of some healthy food markers. What I wanted to propose as a challenge is that we don't have a detailed list of ingredients or nutritional information. We have a study in the United States that used a Healthy Index 2015, because when we choose a food on an app, you don't know exactly what you're eating, what you're choosing, how much of each ingredient. So this is a possible way out. I think it's interesting to work with new classification, NOVA classification. And there are some challenges because these are preparations that we don't know in details. We don't know the composition, the marketing strategies that are present in the apps. So you have a picture of the food, promotion, discounts, combo, free delivery. These are some information that you collect. And I also wanted to highlight that there are many studies that study the pandemic and the apps, or the relationship of these two aspects, because it was a transition, a very relevant translation, and transition into the use of these apps. And I wanted to conclude bringing some studies in Latin America. We're talking about a Latin American seminar. This is what we're doing. So what we've seen, I'm sorry, but I can't say that I have I've read all the literature. I may fail to bring something that is important, but when it comes to TV, we have very recent studies of TV monitoring in Guatemala, Argentina, Brazil, using the Informas protocol. They follow the protocol, and also in Colombian TV. And in Chile, there are many studies that monitor publicity on TV. And there is one study that assessed how much the Chilean regulation was able to change the publicity profile to change the way they did publicity. There is a study from Peru from 2018. It's not as old, but there is a lot coming in 2021. And it was a multimedia study with many different means of communication, including digital media. And then we have a Brazilian study on Facebook, another one in Instagram and YouTube in Brazil as well. There's an Argentinian study with websites directed to children, a Uruguayan study that was just published this year with products for children and young and toddlers. Another one for about COVID washing of ultra-processed products in Uruguay on Facebook, and a digital marketing study from Mexico, if I'm not mistaken, 3 social media channels.
And the study in digital media are very recent, as I said, especially those that I know in terms of monitoring of social media of this environment. This is my perspective, we do have studies about consumers, we have studies about consumer behavior in these environments, but we are talking about these environments. So I would like to thank you, and I apologize for hurrying so much, but I wanted to gather the digital aspect and the informational aspect, and now we have more topics to talk about. Thank you. I know that you were hurrying in the end, but we gave her this task to cover both dimensions, and we knew it was going to be very hard for her to talk all of that, to say all of that in only 25 minutes. So I have some questions here, and I would like you to answer them. And I didn't really organize the questions, but I'm going to read the questions, and you can take notes, and then all of you will have the opportunity to answer, okay? Because at least we are going to be able to get all of you to speak at least once. So Elda Tavares asks, how is this conceptual or metric issue related to territory, taking into consideration the current reality of the digital access to food and meals? So I think that maybe Larissa or all of you can, or Larissa and Paula could answer that one. Melanie says, congratulations on your excellent approach, Larissa. I would like you to talk a bit more about the segregation profile of the food environment in Brazil. In what matters do you believe that we are different from high-income countries such as the United States? How can we assess this? It was a very good presentation, Larissa. Congratulations. I am curious to get to know your book. Great initiative. That was from Mario Sirio. Miriam says, in the context of food environment, Swinburne uses the term obesogenic environment. Is it okay for us to use this term considering the reality in which we face here in Brazil for insan and hunger? Luana states, good afternoon. Larissa, could you talk about the transient trend of food deserts and food swamps? Another question for Camila. Camila, what do you suggest as a method to assess informal markets, such as street vendors? And we know that this topic has been mentioned by many people. We need to have a working group after this seminar just to deal with this topic. Veronica states, thank you very much, Camila. Many practical innovations. So thank you. Carlos Rodrigo states, this informal trade issue really needs to be studied. I'm studying the food environment of a hospital in Salvador, and for the informal sector, which is very consolidated around the hospitals here, I will have to build and validate an instrument. I would like to know if you have any recommendations of things that I need to consider and to have in this instrument. So maybe Camila and Larissa can answer this together. Paloma states, I think it was a comment when Camila spoke. There's a study called a marketing, sophisticated and contemporary marketing techniques. I don't know what this person was trying to say here, but another question, Luana, to Paula. Paula, do you have studies that assess marketing strategies in movies or series? And another question from Lais to Paula. Paula, do you know any study about food in reality shows? I don't know how relevant this type of TV show is around the world, but in Brazil, high processed food advertisement and food delivery in the last Big Brother editions has called our attention. The media has mentioned how much these campaigns were effective for companies and how they have repercussed in the digital environment, taking some of the brands to become trending topics on Twitter. And at the time, this called my attention. And I believe that in the next years, advertisement in reality shows will be even more intense. So the advertisement question or comment was on Paula's presentation. So the last comment made by Carla Gonçalves, I am researching the food environment in Uberaba, and Paula's research was our inspiration. So Larissa, you have the floor. After that, we're going to have the book launch, book release, and 5 minutes so that all of you can comment. Well, the first question about metrics and concepts, I think, is related to assessing the digital presence in food deserts and food swamps. And I think that Paula and I, and we talked about this digital environment considering the apps. It ends up being a swamp, a food swamp, because there is this elimination of healthy choices. So because of the advertising strategies, marketing strategies, you end up choosing non-healthy foods. And this also creates an important connection with what Camila mentioned. You know, in food environments, we need to study the consumer behavior, because we believe that this can bring about answers that we generally don't have. Regarding questions, we really need to take this into consideration about terminology of this food apartheid in Brazil. Because of our historical, cultural process, this will be very different from where this term comes from. Even though racism is racism anywhere in the world with its structures, so we should not try to pretend that that doesn't happen, because we do have structural and organizational racism in Brazil, but we need to be careful with the topic. But I tend to agree that in Brazil, we need to consider this food segregation that leads people from different vulnerability states to have different food environments from other people. So I think that Letícia, Camila, and Paula, we're still going to have to talk about this a lot more, because even though we have deserts and swamps, for us, this is still recent. And so we need to be careful and remember that the concept, it needs to be dynamic, but it does need to make sense. And it needs to make sense for those who are experiencing them. So this is what we need to be careful with. Are the people that are actually experiencing this understand this? So Mario is one of my good friends. We work together regarding obesogenic environments in Brazil. Yes, they make sense, but they are even more, they're broader. And it does make sense in the food insecurity context, because Brazil has problems with access to food and also problems with food quality that will lead to non-communicable chronic illness and obesity. And I have 2 slides. It was Olivia's doctoral dissertation. We want to connect Kaizen's metrics with the proposal of quintile metrics that we really like. And so I'm sorry, Olivia, and I'm sorry, the rest of my group. Our trend for the food deserts has been decreased. The swamps increased. We have moved forward in the metrics. I tried to have a spoiler here, but I couldn't. So we can do this at a later time. But we did a recent study and we are submitting it about the trend of food deserts and food swamps in Brazil. And, about the informal market, I agree with you. Letícia and I have had so many conversations about this. We tried to work with this, with data collection, on the field. There's a study on Tanzania that was published recently. And I do believe that this discussion will become more consolidated in the next few years up until we meet again at the next seminar. I don't think that we have the right answers so far. Camila? Thank you, Larissa. Thank you, Letícia. Thank you for your questions. I can't answer all of the questions, especially about the informal market, but I'm going to talk about the experience that we had at Jundiaí. First, we look at the secondary data of the local city hall, of everything that was registered as food sales that happened in that city. And after that, we would have liked to have more details that we didn't have at the time. We wanted to observe the sale of ultra-processed foods, of natural foods, of other strategies, and we went to the field to do that. And when we looked at the territory, we realized that there were these many doors that were not registered. These were just normal households. And within these homes, they were selling food. And, we know that this is something that our country has. And this is, shown in different ways in different cities here in Brazil. Probably in Rio de Janeiro is different, in the different slums or communities in the, the inner city, São Paulo, and in smaller towns. But we do need to go to places and understand the reality there. As Larissa said, we need to listen to people, to the ones that live in these places. This is extremely important. We can talk about this. So we should, carry out interviews, understand how they are purchasing food, how they're processing this. So this is very important for us to consider the influence of the formal market and the informal market in these people's lives. And we need to understand that the researcher can decide what topic they want to study. Do they want to analyze prices, promotion, access, sales, discounts, whatever? What will be the instrument for that? It depends. Maybe you will have to connect them to other aspects in terms of quantity and quality. And maybe you can ask if Brazil has, advanced in this. And I will say yes. And I am going to mention another paper of assessment of the hospital, close to the, actually the areas close to the hospital. And we do have this study already carried out. And I think that you should read that because they do have results that have been published of assessing the area of hospitals in Rio de Janeiro.
So now I was thinking about street vendors. And maybe in this scenario, maybe especially this is very important for us to assess the food quality because of food security. I don't know how to do this. I don't have the answer on how to do this, but I think this would be important criteria to be assessed in this more informal food sales scenario. And just to conclude, we need to think that Brazil will implement next year a new nutritional law, and we have countries that have already implemented this, and they can see changes both in the digital environment and in the physical environment as well. We see stores changing the turning the label. They are building pyramids or trying to conceal the frontal label. And we're going to see this probably in 2023. And this will bring about a need to review our current systems, our current methodologies to capture these new strategies that this retail and distribution market will bring. I think that's it. I think that's what I had here to say. Specifically, Camila, on this last point that you talked about, this label verification tool, there was a coordinated study about this. I think it was by Unirio people. Yes, we are studying labeling. There is a labeling and monitoring study, but we still haven't reached the point of saying how this happens in the retail, but we do have the strategy in labels. And of course, this will also migrate from the physical space to the digital space. And I think Paula would talk a little bit more about this because this is very interesting to consider when we assess these environments. Okay, Paula, you have the floor. It's it's very nice to see these comments because we say, oh, what about the series? What about the movie? What about the supermarket? Which is something that I want to talk about because we still haven't reached the supermarkets, but digital supermarkets have been in our lives for a long time and we still haven't managed to monitor it. About films, we did a study on children's films. We wanted to cover publicity for cartoons. We ended up talking about the presence of foods. Of course, when there is a hamburger, there are many brands, the colors, but there was no explicit publicity. So we did this for films based on another study that had done this before. Much of what we see today in publicity of foods, we have other studies on alcoholic beverages and tobacco. Lais talks about reality shows and Big Brother, and this is something that is has a strong presence in the media. But I don't know if you remember, but at the beginning of the pandemic, there's a number of studies that we need to study and learn about because we're still in a very descriptive phase. There are many dimensions to be described and unraveled. And I think that these are spaces such as films, reality shows, series, and people don't watch TV anymore. People don't watch TV as they used to. And about the deserts and the swamps, that was the first question. There are some international studies that take address from people and see what arrives in terms of restaurant apps. What it did in Belo Horizonte was to take two neighborhoods of each one of the region and see what arrives. They have very different socioeconomic profiles, and what we see is that the main apps reach all the neighborhoods, but there is a difference in number of restaurants that reach the neighborhoods. There are some neighborhoods that are covered by many restaurants, depending on the level of income, and some markers. The profile of restaurant privileges one or other sector, which is what we talk about when we talk about deserts and swamps. That's what Sabrina was saying yesterday, that the digital environment is a reality for everybody, but it has the nuances, and we need to know more about, learn more about it. Because there are so many things that sometimes our brains boil and you can't move. So we need to describe all the different layers so that we can understand the context as a whole, because it's when we start working with it, we don't know exactly where to begin because there are not many references. So we face many challenges. But I am aligned with what everybody said, all the suggestions. I think that all the suggestions are very interesting, and these are spaces that need to be monitored. You're right. Thank you very much. Thank you, Paula. Thank you, Camila. Thank you, Larissa. I just wanted to make a quick comment and say that we tried to work with magnifying lenses on each one of the aspects, but this is a whole and complex system, and things happen in layers. And I think that the point that we take from this panel is how important it is for us to measure the informal market. I don't know if it was in 2017, but I remember Rafael calling everybody to say we need to work with marketing. We need to work with publicity measurement. And that was when we started working with it. And Camila remembers talking about the tools and instruments for each one for a given consumer with more or less detail. And we advanced in this sense as well. Larissa talked about the concept and the history of the concept. And how important it is for us to debate some of the nuances of the concepts that are more geared towards inequality, be it racial or income inequalities. But we need to mention a very important comment on the chat saying that informal sales reveal a lot of our food culture. We can't disconsider this. We need to talk about this because we need to bring sense or to make sense of this so that we don't make mistakes, so that our assessment is reflects reality. So we need to talk so that we can improve. There was this panel where we heard a person from the city government talking about the deserts, the food deserts, and the person was saying that you needed to increase the sales of greens in the desert of Campo Grande in the city of Rio de Janeiro. So that's why we're here. We're here, we discuss everything in the academia, but then we see a city manager talking about it. So it's great. I think we are going the right direction. We have many challenges that we need to face, but I would like to make an invitation. All of you who are dedicated to the seminar, I would like to invite you to reflect collectively and in a collaborative way. Okay, so I'd like to thank all of you. I would like to invite you to keep watching all our participating in our seminar. We're going to have the book launch and very interesting discussions still. Thank you very much.